we found on your x-rays here was some pretty significant disc degeneration down to your L5-S1. And it looks like this was a result of the injury. There's what we call a Smorl's node, where the disc pushes up into the vertebrae above and does almost like a micro fracture. As you can see here, we'll kind of zoom in. This little part right here, it looks like the lumbar disc, when you had the accident, pushed up into the bone above and almost did a micro fracture to the end plate. That also caused some narrowing of the foramen, where the nerves run out of your lower back. So you can see here, he has a very good patent IVF, where there's a good no compromise of the foramen as we go down. Same here, but as we get to L5-S1, you can notice here there's definitely some decrease in the spacing that the nerves run out of. That can cause some pretty significant pain that goes into your leg. So, we were able to properly diagnose them and see the old injury. That allowed us to focus in on some of the treatments to provide to his lumbar spine. All right, we're here with our patient today, Mr. Robinson, and you came in about two and a half weeks ago. You had chronic low back pain, some pain in the legs from an old injury. You were dunking a basketball, and that was about 8 years ago, and you continue to have pain almost every day in your back and your legs. Tell us a little bit about the injury and what you went through for those 8 years.
As soon as I did it, I knew something was wrong. I went vertically, grabbed the rim, and as I pulled myself up, I knew something just pulled. I came down, bending over, actually, in the same spot for like 20 seconds. I knew I did something wrong, but after a while, I was able to stand up straight, and from there on, it was just pain constantly.
Okay, and you had pain almost every day?
Every single day. It felt like little needles in the back of my back. Every time I would bend down, or I was an old man for like a long time. I had to sit down putting on my socks, couldn't really do anything. Even standing up straight for a long period of time, it would be like a little needle in the back of my back. So constant pain, aggravation.
And you found our office on YouTube. Yeah. What was going through your mind when you saw our treatments?
Relief. It's like, how you see somebody else filming it, it's like you want to experience the same thing, because as you were treating other people, I could see it would totally give me relief through that. So this is I tried everything. People standing on my back trying to adjust myself, but that didn't work.
Okay. And while this is not typical, you came in about 2 weeks ago. After the first treatment, what did you feel?
Total relief. I mean, whatever was snapped back into place was snapped back into place instantly. So I knew from whatever that maneuver was, it got everything back into place.
So we started Mr. Robinson on some physical therapies here in the office. He's been doing some back exercises at home that we prescribed to him, and also getting some adjustments to his spine. This is his third treatment. What percentage are you feeling better since you started after the 3 treatments?
I'd say 95.
95% better. So far so good. We're gonna continue to try to get him 100% resolved, but up to this point, his conditions are improving. All right, we just finished with some of the therapies on our patient's lower back, and now we're going to adjust his lumbar spine and pelvis. And we check the legs just to see which direction the sacroiliac joints have shifted. We do a Thompson leg check. Good. It looks like some of the rotation is on his left sacroiliac joint. So we're gonna go ahead and adjust that now with his lumbars as well. All right, can you lay here on your side, please? Face me. We're moving his top knee up. And this is a side posture, lumbopelvic chiropractic adjustment. Just cross here too. Oh, great. And let's see, lay on the other side, please. That's great. And there's also some rotational elements in this upper lumbar spine that we're going to address now as well. Shoulders back. Very good. And we're going to sit up, face this wall here, please. Scoot back a little here on the table. We're going to cross this arm here. This adjustment allows us to get a very difficult area in the thoracolumbar junction. It's often very tight, but we use this technique to adjust the vertebrae between the thoracic spine and the lumbar spine. Lean forward just a little. All the way back. Very good. And let's sit up. All right, we just finished with the chiropractic adjustment. Now we're going to start with the patient's exercises. Nice and high with the leg. Hold for a second and down. Ups the leg. Reach that. So for the folks watching at home that may have some questions about what happens when you injure your disc, we have a very good little short video here. So as you have some type of injury or compression to the discs in the lumbar spine, you can see, that causes the disc to protrude out, and it can end up pressing on the nerves of the lumbar spine. These nerves run into your legs, and it can cause some ongoing pain in the legs, tingling and numbness. So this is a very good example of what can happen when there is an injury to the lumbar discs in the lower back. All right, so we just finished with Mr. Robinson's treatment. How do you feel?
I feel great.
Okay. So this has been a success story in our office. He's been here 3 treatments. He's feeling almost 95% improved. This is your Raleigh, North Carolina chiropractor, Dr. Jeffrey Gerdes. Until next time, thanks for watching.